I have checked the chart and I have all the equipment that I need, and I'm gonna start from the beginning. Hello, my name is Alexia. I'm going to be your nurse today. I'm going to shut the door for privacy. I'm going to wash my hands, put on gloves. Today we're going to do a head-to-toe assessment. Can you verify your name, age, and date of birth for me? Good. And do you know where we are? Good. My patient is alert and oriented, ×4. Do you have any allergies? Patient states no allergies. Do you have any pain on a scale from 0 to 10? 0 being none, 10 being the worst pain imaginable. Patient states no pain. I'm now inspecting my patient. She is sitting upright, no use of accessory muscles when breathing. Her skin color is appropriate for her ethnicity. No signs of mobility aids, medical equipment, or dressings. Hygiene is upkept. No odors. She's dressed appropriately for the weather. Her height and weight is appropriate for her body stature as well as her BMI. I will now ask permission to take vitals consisting of heart rate, blood pressure, respirations, oxygen, and temperature. All of those are within normal limits as well, and I will have documented them. So to begin our assessment, I'm going to ask the patient if it is okay if I assess her skin. So I'm going to start off with the head. So I'm going to touch her head. I'm looking for any lumps, lesions, scars, wounds, or infestations. None of that is apparent. Even hair distribution, any pain or tenderness while I touch you. Patient states no pain or tenderness with palpation. My patient also has a normal cephalic head shape, and her scalp color is normal with her skin tone. So I am now going to move on to the rest of her skin. So I'm going to ask her to take off her shirt. So my patient's skin is normal, dry, well moisturized. Temperature is warm, skin is moisturized and even. No signs of lumps, lesions, scars, or wounds. No discoloration noted with the skin. I'm going to pinch underneath the clavicle to test for dehydration. No tenting is present. Good. I'm going to check for any deformities on the posterior chest, as well as, the anterior chest as well as the posterior chest. Skin is smooth, moisturized, and warm. Spinal curvature is normal. So I'm going to tell my patient to put her shirt back on. Going to assess the fingers and fingernails. Patient's fingers and fingernails are clean, round, short. No clubbing is present. Capillary refill is +2 bilaterally. So now I'm going to move on to the lower extremities. My patient's legs, no signs of lumps, lesions, scars, wounds, or dressings. Even hair distribution is noted. Patient's skin is smooth, warm, and even. No edema is present. I'm going to check my patient's toes and toenails. No clubbing is present. Capillary refills +2 bilaterally. Less than 2 seconds, my bad. And no clubbing or broken nails. And there was also no clubbing with the fingernails than 2 seconds with the fingernails. So I'm going to cover my patient back up. So now we're going to move on to the head, face, and neck. So looking at my patient's neck, we'll just check for jugulovenous distension on the right side as well as the left side. No JVD is present. I'm going to feel for the lymph nodes. No swelling of the lymph nodes, no thyroid enlargement. I'm going to have my patient look up, down, side, and side. My patient's neck has full range of motion. So now we're going to move on to the face. My patient's eyebrows and eyelashes are even and full. The patient's face is symmetrical and no drooping of the upper eyelids or sagging of the lower lids. My patient's sclera is white. Bulbar conjunctiva is clear. Iris and pupils are even and round. I'm going to pull down patient's eyelids. Palpebral conjunctiva is moist and pink. And now I am going to test my patient's third and fourth cranial nerves. So I'm just going to shine a light into your eyes and just look at my nose. My patient's pupils react and dilate bilaterally. And now for the sixth cranial nerve, I'm going to have my patient follow my pen with just her eyes. Good. My patient's eyes accommodate to direction. And so now I'm going to move on to the ears. My patient's ears are symmetrical and even with the head. No discharge is noted in either ear. I'm now going to further assess my patient's ears by looking in them with an otoscope. My patient's canal and tympanic membrane are normal. I'm going to touch my patient's ears. Any pain or tenderness? Patient states no pain or tenderness with palpation of pinna and tragus. And so now for the eighth cranial nerve, I'm going to say a number. I'm going to stand behind you and say a number, and you just repeat the number that you hear. 8. 8. Good. And now we're going to move on to the nose. My patient's nose is center and midline to the face. No apparent discharge. I'm going to have my patient look up. I'm going to look in there. Nasal mucosa is pink and moist. Septum is midline. So now I'm going to have my patient plug one nostril and plug the other and breathe in. Good. And now I'm going to move on to the mouth. My patient's lips are pink and moist. I'm going to take my tongue depressor. And my patient's teeth are clean and intact. Gums are pink and moist. I'm going to have my patient open her mouth. Oral mucosa is pink and moist. Throat is pink and moist, no irritation with the tonsils. Tongue is pink and moist as well as midline. I have stick my patient. I'm going to stick my tongue depressor in my patient's mouth and say ah. Uvula rises and falls midline. To check the 9th and 10th cranial nerve, I'm going to make my patient gag slightly. Good, and can you swallow? tenderness with swallowing. My patient states no pain or tenderness with swallowing. And for the 12th cranial nerve, I'm going to have my patient repeat after me. Light flight dynamite. Good. And now we're going to move on to the respiratory system. So, have you ever had any trauma, surgeries, or environmental factors that would affect your respiratory system? The patient states none of that is apparent. So now I'm just gonna touch around. Any pain or tenderness? And now I'm gonna tap. Any pain or tenderness? The patient states no pain or tenderness with palpation or percussion. I'm now going to do the same to the back side. Any pain or tenderness? Patient states no pain or tenderness with palpation and percussion. My patient's thorax is symmetrical and full. So now I'm going to listen to your lung sounds and just go ahead and take a deep breath every time you feel my stethoscope. Good. We're going to do the same thing on the back side. Just take a deep breath every time you feel my stethoscope. Good. My patient's lung sounds are clear, no adventitious sounds are noted. Her inspiratory and her expiratory phases are even. She has efficient use of lung expansion as well as oxygen. So now we are going to move on to the cardiac system. So I'm going to feel for the carotid arteries. Carotid arteries are detected. Rhythm is normal, rate is steady. I'm going to listen to the carotid arteries for bruits. No bruits are detected with the bell side of my stethoscope. So now I'm just going to listen to 5 different spots, and we're going to listen to your heart on your chest. Good. Heart rate sounds normal, and I'm going to feel for the heart. Point of maximal impulse is detected. So now that we're done with the heart, the cardiac system, I'm going to raise and lower the bed to assess the abdomen. So I'm going to uncover my patient, just the area that I'm going to be assessing, while still keeping her covered for privacy. So by inspecting my patient's abdomen from this side, as well as this side, the patient's abdominal area is her contour is flat and round. She has normal stomach movement, no lumps, lesions, scars, or wounds. She has even hair distribution. Her umbilicus is midline. So now I'm going to listen to her abdominal area. starting with the lower right quadrant. Good. I'm going to listen to the abdominal aorta with the bell side. Good. No bruits are noted, as well as active vowel sounds in all 4 quadrants. So now I'm going to ask my patient to raise her head, as well as flex her stomach muscles. No inguinal or abdominal hernias are noted. I'm going to touch around in a circular motion on her stomach, on her abdomen. No pain or tenderness, percuss and circular motion. My patient states no pain or tenderness. So now I'm going to cover my patient back up. I'm going to lower the bed. Put my patient in a comfortable position. So now, to part of the abdominal assessment, I'm going to have my patient sit up. I'm going to tap slightly to test for kidney pain. Any pain? Any pain? My patient states no costovertebral angle tenderness with percussion. So now, we are now going to move to the musculoskeletal part of the assessment. I'm going to have my patient stand up and walk to the end of the room. I'm going to assess her gait, which is normal. She's walking from heel to toe. She has efficient use of balance. So now I'm going to have her stand in front of me, feet together, arms to her side, close her eyes, and I'm going to further assess her balance. My patient's balance is efficient. Now I'm going to test for range of motion. I'm going to have my patient raise her arms above her head, pull her arms back, out to the side, and same with her legs. Raise them out, pull upward, backward, and out. Good. My patient has full range of motion of upper and lower extremities. I'm going to check for joint stiffness in my patient's joints. No pain or stiffness with the joints. I'm now going to have my patient take a seat again. I'm going to check for radial pulse, +2 bilaterally, and check the pedal pulse, +2 bilaterally. Now I'm going to test the 11th cranial nerve and have her resist against me. So raise up your shoulders and resist. Good. And same with the face. Resist against my hand. Good. Other side. Good. Have my patient raise up her arms and resist in, out, towards you, towards me. And then same with the legs. Raise them up, pull them down, out, in. Good. My patient has 5 out of 5 muscle strength. And now for the neurological part of the assessment, I'm going to test your memory. So I'm going to test your immediate, remote, and recent memory. So for the immediate memory, I'm going to tell you 3 words, and I'm going to ask for those 3 words again in about 5 minutes. So the words are blue, car, and dog. For recent memory, can you recall what my name is? And then for a remote memory, can you tell me the names of your high school graduation? Recent and remote memory of patient is efficient. So now I'm going to test my patient's tendon reflexes. So I'm gonna have her sit at the edge of the bed. I'm going to test for patellar tendon reflex, biceps reflex, and brachioradialis reflex, which are all good and active. I'm now going to have her sit back into bed, and I'm going to test for sensory. So I'm going to take my cotton ball and my dull end and my sharp end of my tongue depressor. So just go ahead and close your eyes and tell me when you can feel this. Good. Good. Patient sensory is efficient. So now I'm going to test for coordination. So I'm going to have my patient touch her nose and then touch my fingertips. Good. And then I'm going to have my patient stand up and bring her heel to her opposite knee and drag it down her shin. And then same with the other one, heel to knee, drag down the shin. Patient's lower extremity coordination is efficient. Now we're going to move on to the cranial nerve part of the assessment to finish up. So for the first cranial nerve, I'm going to have my patient identify this scent, close her eyes and identify this scent. Good. That is mint. And now for the second cranial nerve, I'm going to have my patient cover her eye and read the smallest print on the chart across the room, and then cover her other eye and read it backwards. Good. And for the fifth cranial nerve, I'm going to have my patient close her eyes, clench her jaw, and identify this sensation. Good. And for the seventh part of the the seventh cranial nerve, I'm going to have my patient wrinkle her eyebrow, her forehead, puff out her cheeks, smile, frown, and stick out her tongue. Tongue protrusion is midline. And can you repeat back to me what those three words are? My patient's immediate memory is efficient. And now we are all done with our assessment. So I'm going to remove my gloves, wash my hands, give you a call light, and